So the other thing was that the starting blood pressure across the way before he came on the table was 214 over 102, so significant hypertension. Pressure we've just put on now. What's this measuring out at, Jim? 223. So blood pressure is 226 over 104 as we stand at the moment. We're in the left renal artery here, and you can see a picture there. It's really nice and long, and we're going to aim to treat that from where we can see it close to its origin. All right, let's go. Can I have the Symplicity catheter open, thanks?
This is the denervation catheter, the radio frequency probe at the end of it, and goes through a 6-French sheath. It's steerable at the hub, which allows us to make that spiral around the artery, and we can flex it and steer. And before we do a burn, it needs to be completely flexed so that it opposes the tip of the catheter to the wall of the artery. Goes into the generator. The patient's earthed.
Okay, so we're going to insert that into the renal artery now. Okay, we're going to apply the first treatment. Grab that, Rach. So that the patient's had a significant amount of sedative and analgesia, including intravenous paracetamol and benzodiazepine, to keep them nice and relaxed, because this part of the procedure can be a bit painful. More painkiller coming now. Just flush, big flush. It's 22% impedance drop there. So the catheter's measuring a drop in impedance, which means basically a successful burn, in that we're penetrating through the superficial layer of the end of the artery.
So once the catheter's in the vessel, it's
downhill.
Slightly difficult to steer.
So we've gone from the top of the artery now to the lateral wall of the artery. We'll apply the second burn there once we're happy that the patient is sedated again with more analgesia on board. So we aim to treat the artery with a 2-minute burn, and we're looking at the device which is measuring the amount of impedance that's dropping and the temperature as it goes up, and that tells us that we've got successful treatment at that particular spot. Do one more?
No, that's it. No, that's it.
Just a bit shorter.
Yeah.
Okay, so burn number 5 here. Okay, so we've treated one artery there with 6. If you just pull it out, 6 burns, all extremely good. Okay, I'm just going to take this catheter out and wipe it down, and then we'll change sides. So we're going to swap over. And go into the right renal artery and do exactly the same thing.